The recent COVID-19 pandemic has shifted the lives of people around the world, especially the homeless people. Good day, fellow researchers, College of Nursing, University of St. LaSalle, and everyone who is watching. I am Elea Phoebe Suarez, and together with me are my group mates, Princess Sugaton, Alexandra Nicole Tolbo, Althea Mecailah Vertudazo, and Micah Emmanuel Velez. We are from BN3F Group 4B, presenting our research entitled Live Experiences of Homeless People in Healthcare Service Utilization Amidst COVID-19 Pandemic. All facets of life have been negatively impacted by the COVID-19 pandemic, but most significantly, the people's health. The homeless are the unrecognized victims of this pandemic. Poor access is a big challenge considering that the homeless people have a high degree of healthcare needs. This study aimed to explore the lived experiences of homeless people in healthcare service utilization amidst COVID-19 pandemic.
Qualitative phenomenological research design was utilized in this study to focus on the lived experiences that are common to a certain group of people. The methods used to conduct the study were done through a series of face-to-face interviews with the participants as the key informats. A semi-structured interview was used for the data collection regarding the topic. The Lincoln and Guba trustworthiness method validated the interview guide on how the pattern in which the participants react or respond to each question. Overall, all ethical considerations were followed during the interview.
For our participants of the study involves 5 participants who were purposely selected. For our inclusion criteria, the participants are middle-aged women from 29 to 65 years old, experiencing homelessness for the past 2 years or more, especially during the pandemic, and residing in Bacolod City, and must be a mother with children.
Moving on with the themes. In the midst of the COVID-19 pandemic, homeless people face unprecedented challenges as their access to basic necessities and services became further limited. 6 themes emerged from the responses of the participants. These themes explore the experiences of homeless people during the lockdown, shedding light on their struggles, health and healthcare utilization services, coping behaviors, and the external support they received. Theme 1 explores how the lockdown imposed by the government significantly restricted the movements of homeless people. They faced barriers in accessing essential services such as food, shelter, and healthcare. Public spaces that served as a refuge were no longer available, leaving them vulnerable and deprived. Theme 2 discusses how the pandemic brought financial hardships, causing scarcity of income sources for homeless people. As everything closed down, it limited their opportunities to earn a living. The struggle for stability and the scarcity of resources made it even more challenging for them to meet their basic needs. Theme 3 explored their health and the healthcare services during the pandemic. The overall well-being of homeless people was not directly affected by the virus. The government and the healthcare providers played a vital role in ensuring their health and safety. Vaccinations, medications, and regular checkups were provided, enabling homeless people to maintain their health. Theme 4 presented how homeless people receive assistance from their families, the government, non-profit groups, and local volunteers. Food and basic health care were provided to ensure their safety and well-being. The active involvement of the community contributed to uplifting their lives during this challenging period. Theme 5 exhibited how homeless people displayed remarkable resilience and resourcefulness. Homeless mothers in particular prioritized their children's well-being above their own. Personal hygiene practices were valued as preventive measures, and despite limited resources, homeless individuals strive to help themselves, demonstrating their strength and adaptability. And finally, Theme 6 explored their faith and spirituality, how it played a significant role in providing them with hope and inner strength in these trying times. Believing in a higher power helped them cope with the challenges brought by the pandemic and gave them a sense of purpose.
For the conclusion, this study revealed a range of challenges and barriers that homeless people face during the COVID-19 pandemic, as well as their strategies for overcoming these challenges and impediments. The experiences of homeless people during the COVID-19 lockdown were marked by limitations, financial difficulties, and health concerns. However, their resilience, positive coping behaviors, and external support, as well as their faith, served as pillars of strength. The community, the government, and the healthcare providers played pivotal roles in ensuring their well-being. By acknowledging their struggles and addressing their needs, it is possible to continue to build a more exclusive and inclusive and supportive society, one that leaves no one behind.
For the recommendation, this study emphasizes the importance of comprehensive approaches, collaboration among stakeholders, and increased resources to effectively manage the health impact of COVID-19 pandemic on homeless individuals. It also encourages healthcare professionals, student nurses, and future researchers to fill the gaps to the homeless people by conducting more research on homelessness with homeless people as their participants, and to also actively engage with and address the unique healthcare needs of homeless individuals and to contribute in improving their well-being. You can also check our reference by scanning the QR code presented in the screen. And that is all for our presentation. Thank you for listening.